Viewers, good evening. My name is Faith. I'm happy once again to record a video for you. It's been long actually since I last recorded a live video. I've been recording like without voice. I had things that were making me busy actually. But I'm here today and let's start. Actually today I'm dressed as I normally dress in my uniform as an ACA at the work where I work in a hospital, and this is my card. It's my card. It's a must have, and this is the pocket, the small bag that I put in my pocket where I put my pens, and this is my name tag, and this one is my watch. I need it all the time. So the other equipment that help me to work. Okay. I am a nurse by profession. I am actually a nursing associate, but because I'm not registered as a nursing associate in the UK, I work as a healthcare assistant. Today I'm going to tell you how I got this job as a healthcare assistant in NHS UK. I went online and started searching for NHS jobs, and then on the website I logged in, I registered and sent in my application. They told me to wait, and after I waited, they replied me and they told me they will get back to me. They scheduled a day for an interview. So the interview was virtual, and yeah, it went well actually. And after a few days, I got a reply that I had been given a post and a job. Actually, I had been given a job, but getting into job, the process from when I started applying the job, when I started applying the job up to the time I got the job was very long actually. It took me 6 good months before I got the job. It was a very long process. The reason why it took that long, because I had to get referees. They have to get DBS. They have to, but I got it anyway. So currently I work with NHS as a healthcare assistant in the hospital. Yeah. So if you are there and you're interested in working in NHS or in any hospital, there are so many hospitals in the UK. You go to the NHS website and then search for the jobs they have, search for your post. If there's a job that is being available, please just go ahead and apply if you're sure and confident and you're qualified, so they will give you the job. So there's also a process of ordering uniforms. These uniforms are ordered online, and so after that you get, after a few weeks, you get your uniforms. Yeah, that is briefly how I got this job. What are the requirements? The requirements actually, there wasn't that much the requirements. You just needed to just apply, and if you have any qualification, that was an additional advantage. If you don't have, they will examine you, they will interview you and see what you have, and then if they see that you have what they want, you have what it takes to be a healthcare assistant, then they'll give you, because they will train you when you're there. the trainings that come along with it. And how much do I earn as an HCA, healthcare assistant? As an healthcare assistant, the basic salary is around, when you're working day, is around 1,500. It's not much actually, but that's what they offer if you're working day. But there's so many other ways where you can earn a little bit more, but that depends on the hospital where you're working, the manager that is working with you, and things like that. So there are advantages, there are ways of adding on your salary, but you may not be given that opportunity, or you may be given that opportunity. For example, if you're working night shifts, you can earn a little bit more. If you can do extra hours, because the hours for the basic hours for a permanent HCA are 37.5, but you can work more. But also that depends if they give you opportunity. Your manager may deny you that opportunity, to get extra money, and then they keep you like on a basic small salary. But I'm just telling you so so you don't go like blind. It's 1,500, but there are chances of adding on your salary. Yeah, that comes every month, and yeah, they will pay you monthly. But if you work extra hours as a bank staff, or they take bank staff like extra hours, they will pay you every week. So that's an added advantage. So I call upon all people that are interested and want to work as health assistant, or you are anywhere you are around the world and you feel like you want to come to UK and work as a healthcare assistant. Just don't fear, don't sit back, go to NHS website and search for the jobs they have. Apply in any hospital, in any area. There are many hospitals, I'm telling you, there are many hospitals. I'll try and search for these hospitals, and there are so many hospitals in this country. So in any area you want, there is a hospital, so you can apply and get in that hospital, and they need workers, so you can earn yourself a living. Yeah. If they don't give you to work as a permanent worker, don't worry, you can work as a bank staff. You work as you want. You select days, especially if you're a student or if you have another job. You can work as bank staff. Come, do the days you want, 1, 2, 3, 4, 5, whatever, and go and living like that. So it's not going to bind you. If you don't want to work as permanent worker, you can work as bank staff. Flexible, easy, things like that. So I welcome you. I urge you people, don't be there, don't be like missing on this chance. Please come. There are jobs in NHS for HCAs, and so many advantages, so many opportunities. Please come and join. What are the job responsibilities that healthcare worker has? I'm going to tell you briefly what we do actually when we go to work. If you're working morning hours, like the whole day, normally work long day. We work from 7:30 up to 8 o'clock. When you get to work, the night shift is closing, and they are going to give you a handover. They'll tell you what happened at night. They will go through all the patients they have and everything. So they will give you a number of patients depending on what is on the ground. Then first of all, we start by saying, if you have patients to feed, we start by feeding them, like helping to feed them. You start by giving them breakfast, and after that, after they have eaten, then you look through their files and start recording, like updating the file, and after that you can check your patients if they need help, with like maybe changing clothes, changing pads, changing their gowns, and after that, like making beds, things like that. So if there are patients that need that kind of service, then you go ahead and do it for them. And after that, we also do observations. The kind of observations we do they are they are they are called actually news score news 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 two scores. And we do like the blood pressure. We take blood pressure of the patients, and we take their temperature, we take their temperatures, we take their oh sorry, if I'm actually, something has distracted me here. There is somebody here and is distracting me. But let me continue. We take their blood pressure. We take their heart rate. We take their temperature. We take their respiration rate, and we take their saturation. The saturation depends if a patient is on oxygen or not on oxygen. So you have to record all that information in the vital pack, and if there's alarming, if they're scoring high or scoring very low, you're going to report that to the nurse in charge, or just the nurse who is with you, who is working with you. So the vital pack is like iPad. When you record that information, it will show you how this patient is scoring. I'll make a video and show you how we make observations. This is a system that is used by NHS to follow up the well-being of the patients. So that's actually, it shows us whether the patient is still okay, or the patient is fair, or the patient is dying. And if we stop doing the observations, that means that the patient is palliative and is waiting to die. Okay. We also do like mouth care for patients, especially patients who are palliative. There are patients who have NG tube, who are nil by mouth. You also must know that this patient is nil by mouth, and I'm not going to give them anything to eat, or somebody may have an NG tube in their mouth, but they eat something small. If you have to help them, like check their nutrition, and there are so different. There are very many different things that we actually carry out. When you get to the NHSC, they will train you how to go about all this. Don't be scared. When you get to NHS, it's very hard actually to give you this in theory, but when you're there practically, you learn how to do this, and your job will go smoothly. So we also have breaks. We have the first break comes around 10 o'clock. It's for 20 minutes if you're working long hours, and we also have breaks at around like 1 o'clock onwards, and that one is for 40 minutes. You go eat depending on where you want to eat, and yeah, we have doctors that come in, check the patients, and actually the doctors are around from 9:30 up to 5 o'clock. So if there's something that you want to take a doctor, yeah, even if you are a relative, you can still talk to the doctor, things like that. We have telephone services. If a relative wants to know about the patients, we can pick them and give them the information they want, and we ask different questions before we give the information. Yeah, we communicate with other wards if we have, for example, like admissions, discharge, changes, and things like that. Oh, yeah, it has been an interesting experience working in a hospital, and I do not regret what I have learned. It has been eye-opening, and I urge everybody who is out there and would like to get this experience working in NHS as a healthcare assistant, please, you are welcome. I think with that, I will stop here today, and I'll prepare another session where I'll teach the audience more about the observations, the new scores, and news 2 scores, and the vital park, and I'll show you everything, and I'll tell you how the different types of professionals that we work with. I'll go in details, and I'll show you a little bit inside the hospital. It may not be very easy to record the hospital because it's not acceptable, but I'll see what to do. So that is it. If you are there, you're hoping to come to UK, you are in UK and you don't know how to work with NHS, you just admire people working in NHS, please come, go to the NHS website. I repeat, this NHS website. Search for the jobs they have in any area where you don't have to go to move to any area. There are hospitals everywhere. Apply, and if you qualify, you'll be given a job. I'll be happy to work with you, or see you. If somebody will comment down that they got a job in NHS or they started working with NHS because of my video, I'll be the happiest woman on earth. And I request you people, my viewers, please subscribe. I have very few subscribers, and I am very grateful for my subscribers, but I urge so many of you out there, please subscribe, support me, and I also give you different videos. That's me. Everything that I see that I think that other people will need it, I'll give it to you. I'm not going to specify that I'm only going to give you this, I'm only going to give you this. Anything that I see that will benefit the public, will benefit other people who are there, who are like me, I'm going to bring it to you. So I need your support. I need you. Please be there for me, and I'll be there for you. I love you. Peace. Bye.